Now let's do what most people do first. Okay? So you've sat down, you've examined, and you're about to start your management plan. Okay? So Jade Betty, thank you so much for coming. I know this, you've been struggling with these headaches, and I appreciate you coming in. Thanks for asking all those questions in the examination. I mean, reassuringly, having a chat with you, it seems like we're dealing with a migraine. Now, I know you thought stress, and stress can be linked with migraine, but I think listening to the story, it sounds like we're dealing with a migraine. Is that something that you've heard of? Do you want me to explain that in a bit of detail?
No, that was one of the things that came up when I looked online. So I know what they are, I just...
Okay. Migraines are really common and something that we see all the time. Now, we've got a couple of options that we can think about when it comes to a migraine. Okay. We've got a couple of medications that we can talk about, so I'd like to go through a couple of options that we have for medications. Is that something that you'd like to start with, and then maybe we can talk about some of the other things that you had in your mind a little bit later on? Would that work?
Yeah, okay.
Okay, so when it comes to migraine, there's a couple of treatments that we tend to offer. There's a medication called Migraleave, but there's also other pain relief that people often use as well. Now, if you pause there, I now have gone into options straight away. I've thought migraine, I've done diagnosis, I've offered explanation, but my first thought is options. Now, because I've talked about options, I'm saying for migraine we have this and this and this and this. Now, I'm stuck in medicine now. So I need to get to the end of that conversation where she's decided which option is right for her. We've done the prescription, we've talked about any side effects and interactions that she might come to. And then if I have time, I plan to come back to, you mentioned a worry about a tumor, you wanted a scan, and all that's in my mind. And I'm thinking I need to come to that at some point before the bell goes. And I was hoping that I'd quickly get rid of all the medicine first and then talk about this stuff, but I might get stuck. It's likely that if I start prescribing her medication, she's going to come back to me with some questions. But how do I take it? And I heard that gives loads of side effects, and my mum had that and I didn't like it. Is there anything else? And before you know it, I'm getting stressed because I'm stuck in this options-based management of migraine, because I'm doing a condition-based management approach. And I'm thinking, I hope I have time before the bell goes to mention those other issues. That's very stressful because I'm thinking time, I still haven't said all these things in my head, but the patient is blocking me unfairly and not letting me say what I want to say. Then the bell goes, and I think that was really unfair. I couldn't mention the cancer concern, I couldn't mention X, Y, Z. So that's not a great way of doing a management plan because it looks like you've asked all these questions, but the only thing that you think is important is what drug are you going to give to this patient. Okay, so instead of thinking diagnosis differential, explanation, options, now we'll show how it works with the same two steps, diagnosis differential, explanation, but issues before options. Okay? So let's try that again. So we've just examined, just sat down. Let's go again. So Jade, firstly, thank you for answering all those questions and going through the examination. I know I threw a lot of stuff at you. You mentioned that you thought this might be a bit of stress, but actually having talked to you, examining you, I think we might be dealing with something called a migraine here, and a pattern that you're describing. Is that something that you've come across before? Do you want me to explain that in a bit? What that is?
No, it's okay. It was one of the things I've looked at online.
Okay, great. Yeah, migraines are really common, and actually, I think there are a couple of things here that you've mentioned that we can have a bit of a chat about. There are a few things that I think are important to go through. Obviously, firstly, we can treat migraine. There are treatments, there are options, there are medications, and we can go through all of those and see which one might suit you best if you're looking for a treatment. That's something that we can go through. But you did mention that a couple of things that are important. You mentioned you were worried about a tumor. I mean, the good news is very quickly from talking to you and examining you, that doesn't worry me at this point, but we can certainly go through that. I know it's on your mind. You did mention stress, and you thought that might be a cause. Now, stress can be linked to migraines, and stress needs looking at in general, so that maybe we can have a bit of a chat about that, because that could be important, and that might be something to talk about. And you did mention that you were looking for a scan. I think at this stage, it's probably not the first thing I'd be looking for, but we can talk about a scan and why I don't think at this stage that might be the next step that we'd usually take in this situation. So there are a few things we need to have a bit of a chat about. We may not get through all of that today, but we can kind of get through a few and maybe catch up in a few weeks, see how things are progressing. But was there anything there out of those that you wanted to focus on first, anything that you wanted to elaborate on first?
Well, if you think the stress might be like a trigger or cause, I'd probably rather treat it, maybe start with that to see if we can reduce it. So.
Yeah, absolutely. I mean, we can talk about your stress, and you mentioned work a few times, and let's see what we can do for that. Maybe that will have an impact, and maybe we can look at some of the other things going forward if it's not working.
Okay.
And then suddenly we have a conversation about stress. Now, most people would have gone into medications, because that's what they think this is about. Migraine, nice CKS guidelines, step 1, step 2, step 3, step 4, let's go. Thinking that that's how I'm going to get my high scores. But actually, in this case, the marking scheme may have been nothing to do with medication. But because I've put the issues out there and I've given it back to the patient has said, actually, well, I want to talk about this. So now that's given me the license to start expanding on that issue. How stress can trigger migraines, what other triggers might be there, what can we do for her stress, work is busy, what about some time off, what about talking to your boss? Now I'm talking about an issue that actually is relevant to this, and maybe I'm going to do much better in management, even though I haven't mentioned migraine or anything else or the drugs that most people want to talk about. That's an example of, if you think situation first, then condition second, you're going to probably demonstrate much more early on in terms of what's going through your mind. And an assessor who's watching is thinking, okay, this person understands this case. They understand that, yes, they're diagnosed a migraine, but they have understood the other issues that are also important. And that every question they asked in the first half, the ICE, the psychosocial, the rep, all for a reason. It wasn't just, let me ask all that stuff, get out of the way, but then treat the migraine. It's, I've asked all these questions to understand the issue, and now I'm showing you how do I take this situation forward. And that's how you can start to utilize your time better, and that's why we talk about the golden first minute of management being so important, to set your base, to show that I've got this case, I've understood all the key things, and before I get trapped in one of them in detail, I'm going to get my base out. I'm going to show you where I am, and then maybe deal with one or two of them with the time that I have left. And in that way, I'm not stressed that even if the bell goes, and I'm halfway through discussing this whole work issue, I'm not stressed that I haven't mentioned the medication, and I didn't mention the tumor, and I didn't mention the scan. I did. Got it all out the way. That's why that first minute is so important, and that's why an issue-based management is so much more beneficial than an options-based management. In real life, day-to-day, patient comes with migraine, this is what we treat you with. We do an options-based management because of lots of lesions. But in an assessment, where you're trying to demonstrate skill and ability to handle a situation, options management doesn't work. It just leads to stress. Does that kind of make sense? The difference.